Good afternoon, everyone. My name is Christy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy, and good afternoon, everyone. Today, Dr. Strang is our last outing briefing together. It's our 100th, and over that period of time, there's been lots of emotions. Some sad days, and we've had a few fun days. Remember when we had the Muppets laid them out here in front of everyone, and who could forget "Stay the Blazes Home"? I think people are a bit still startled about my face on shower curtains going around the province, but
me too.
Yeah. But I've also grown to appreciate what a tie says. So your ties have taken on a life of their own in the province. So.
And just let me, Premier, somebody kindly sent me, this is Annapolis Valley Tartan Tie, and this is in honor of you and where you live and who you represent.
Well, you're too kind. I'm looking forward to heading back home this afternoon. But now to get on with the numbers of today, we have 2 new cases of COVID-19. One of them is in the eastern zone related to travel outside of Atlantic Canada, and the other is cases in the central zone and is a close contact of a previously reported case. Our numbers are still low, but we've had consistent cases all week, including a case at Beaver Bank Monarch Drive Elementary School. That school has been closed for a deep cleaning, and a deep cleaning is underway, but the work is still ongoing to determine the source. We are wrapping our arms around that community. A mobile testing unit will be in the community all weekend. I encourage everyone in the area to please get tested. This is how public health will be able to identify and track the virus. We are also running testing clinics this weekend in the Numinus-Wolfville area. This is out of an abundance amount of caution, and your cooperation is greatly appreciated. And on Sunday, a testing clinic will be set up at the Marine Atlantic Ferry Terminal in North Sydney. All passengers arriving in Nova Scotia from Newfoundland are encouraged to get tested. But testing will be mandatory for passengers who are exempt from the 14-day self-isolation requirement. Our vaccine program continues to roll out. In the last couple of days, we vaccinated hundreds of frontline healthcare workers and long-term care residents. Those who received their first shot will get their second shot. And we're expecting almost 14,000 more doses to arrive next week. And I'm pleased to say that we are running our first community-based clinic on Monday at the IWK. And hundreds of Nova Scotians age 80 and above in Central Zone will get their first shot. This is just the beginning of our clinics for seniors. We will be running 10 clinics across the province over the next several weeks. We're also running our first clinic in for Mi'kmaq elders here in Millbrook this coming, or next week, I should say. With that, Dr. Strang, over to you.
Thank you, Premier. Good afternoon, everybody. So since our last update on Tuesday, we have seen case numbers slightly creep up, including cases with unknown sources in both Beaver Bank and Numinus. Both cases are still under investigation, but we are ramping up testing in those communities, and I'll share more details on those testing sites shortly. We continue to look at our neighbors in Newfoundland and are reminded just how quickly COVID-19 can spread. This is why getting tested is such an important step in the fight against the COVID virus. All along, we have been asking people with 2 symptoms to get isolated and get tested. We then asked you to consider adding asymptomatic testing to your COVID-19 protective measures. But I want to remind people that even if you have a single symptom or just generally feel mildly unwell, you need to get tested. Many of the recent cases of COVID-19 we are seeing in Nova Scotia are presenting as mild cold-like symptoms, or even just one symptom. So if you have a runny nose or an ongoing tickle in your throat, it's not something that you should ignore. You cannot think it's not COVID-19. So please, even if you are just feeling mildly unwell or having a single mild symptom, please go online or call 811, book a test. That is how we make sure we don't have COVID-19 and we're not spreading it to others. For this week's vaccine update, I'll begin with a brief recap of our vaccine supply. So since December 15th, we've received 47,280 doses of COVID-19 vaccine. This includes the 10,530 doses of Pfizer vaccine delivered this week. And as we've said before, this was our largest single shipment to date and has been distributed to 8 locations across the province. The number of doses administered and the number of second doses administered is not available at this right now for this briefing, simply due to a technical problem. But when these numbers are available, they'll be posted on our data dashboard, which is on our coronavirus website. Recent reports from the federal government indicate that vaccine deliveries to Canada are back on track, which means that we can expect to see a steadily increasing supply of vaccine in the coming weeks and months, which is great news. We will ensure every Nova Scotian receives 2 doses of vaccine at the recommended time, consistent with manufacturer and scientific recommendations, and we remain on target to be able to give every Nova Scotian the opportunity for 2 doses of vaccine by the end of September. On Monday, we will reach an important milestone as we start our first prototype clinic at the IWK for Nova Scotians who are 80 years of age and older. And I do want to thank very much the IWK. This is not their typical line of business, but they were very willing to put up their hand and say, how can we help out and do all the work to develop this prototype clinic. And I'm happy to report that the clinic appointments have filled up very quickly. We have 500 people ready to get immunized next week, 500 people 80 and above. In setting up this clinic, we have many lessons have already been learned, and we will learn more next week as we go through the clinics themselves that will better position us to roll out community clinics across the province. I just want to remind people who have received an appointment for this prototype clinic that the IWK has arranged for parking spaces for attendees. And this includes street parking that's adjacent to the IWK on University Avenue, a reserved street parking. They have also some reserved spaces in front of the Children's Building and extra accessible spots within the parkade. 3 new healthcare clinics are also launching this week at St. Martha's Regional Hospital in Antigonish, South Shore Regional Hospital in Bridgewater, and Cumberland Regional Hospital in Amherst. I'm able to confirm today that there will be 10 community vaccination clinics starting throughout the month of March. And these clinics are for Nova Scotians who are age 80 and over. And again, 10 locations across the province. About 48,000 Nova Scotians will receive a letter from MSI advising them that they are eligible to receive the COVID vaccine. And this letter will contain information of how, when, and where to book their appointment. The letters will be mailed out between February 24th and March the 5th. Anyone who turns 80 after March the 4th, it will be eligible. It just means that you cannot book your appointment until the day you turn 80. So to be clear, as of March the 1st, any Nova Scotian who is 80 and over or will turn 80 after that date is eligible to book an appointment at one of the community clinics. The booking and the start dates of these clinics will be staggered throughout the month of March, and booking will open 1 week before the start date of a specific clinic. For clinics in HRM, New Minas, Sydney, and Truro, which have start dates on March the 8th, the booking will open on March the 1st. For clinics in Antigonish, Yarmouth, and a second clinic in HRM, which has start dates on March the 15th, the booking will open on March the 8th. And for clinics in Amherst, Bridgewater, and a third clinic in HRM, all of which will start on March 22nd, the booking will open March the 15th. And location details for the March 15th and the 22nd clinics are being confirmed and will be announced before booking opens. So don't worry, there's a lot of information in that. There'll be a lot more communication on this. And anybody who's 80 and above, if you have an MSI card, please know that you will get a letter in the mail with all the details and how you go about booking your appointment. And you can do that just through, you'll be able to book your appointment in one of two ways. You can go online on novascotia.ca/vaccination, or you'll be able to phone a toll-free number. All that information, the website and the number, will be in the letter that is sent out. And because the vaccine is delivered in 2 doses, which would need to be 21 days apart, two appointments will be necessary, and you'll be asked to book both appointments at the same time. And if you provide an email when you're booking your appointment, you will get a reminder by email of your scheduled appointment for your second dose. I do want to stress that Nova Scotians should not be looking to contact the individual locations or the individual clinics to make an appointment. Those clinics are not set up directly to do that. You cannot schedule an appointment with them. You'll need to go either online or calling the toll-free number. And do not come to a clinic without a scheduled appointment. We will not be able to vaccinate you. And again, much more information will be coming on this, and everybody who's eligible will get a letter. All the booking site and the toll-free number will be live as of 7 a.m. Monday, March the 1st. I get more information on that coming. I know there's a lot of interest among Nova Scotians who want to book their vaccine clinics, and I just asked for people's patience as we get all the details rolled out. But we wanted to make sure we have confirmed the dates and times. We wanted to make sure Nova Scotians understood that even though we're starting with a single prototype clinic, everybody who's 80 and above will get a chance to make an appointment and get immunized during the month of March. And if you happen to end up where you're an appointment and it's full and you can't book an appointment, you will be able to get. It means that we just have to schedule further clinics, and you will be able to. Please be reassured, you will be able to get your vaccine. If you are not comfortable, and some seniors may not be coming to a large clinic, you certainly have the option of waiting. We are currently working with pharmacies and physician partners to get vaccine into select locations across the province that would not be large mass community clinics. So if that would be your preference, you're certainly free to wait and wait to go to one of those clinics as well. For all Nova Scotians, we will get to you over the coming months. And while we ask for your patience, but while you're waiting to get immunized, for everybody, please continue to practice public health measures. Washing your hands, maintaining a safe distance, wearing your mask, stay home if you're unwell, keeping your social circle small, and making COVID testing a regular part of your routine. And I have to emphasize again that even after you've received your vaccine, it doesn't mean you can disregard the public health measures in place. At some point in time, we may be able to change that advice, but at this point, we still are concerned that people have the ability to transmit the virus without any symptoms, even after they've been immunized. And certainly a single dose doesn't provide you necessarily the full protection. So even at this point in time, even if you're vaccinated with 1 or 2 doses, we're asking everybody to continue to follow all the public health measures. Next week, the first of 13 vaccination clinics in the Mi'kmaq communities across the province will be launched at Millbrook First Nations. Clinic details are being finalized, and individuals will be contacted to schedule their appointment by the Millbrook First Nation Health Centre. All the First Nations clinics will be managed by their respective health centers in the different communities, and it'll be health center staff who administer the vaccine to those living in their communities. It's been very important in our partnership with our First Nation communities that they have that's their clinics. They have tremendous amount of input into scheduling and who gets vaccinated when. We're really relying on them to communicate about the clinic, communicate in a culturally appropriate and sensitive way to deal with some of the challenges we have around vaccine hesitancy that are specific within those communities. We have been in close contact with the First Nations communities, the chiefs and the First Nations health director for a number of weeks, really back at the beginning of the vaccine program. and it's important that we continue to roll out our vaccines in a culturally responsive manner. We are doing the same. We're not as far along, but we're doing the same with our African Nova Scotian communities. Given the recent spike in cases in Newfoundland, as the Premier said, starting February 21st, COVID-19 testing will be available at the Marine Atlantic Ferry Terminal in North Sydney for passengers arriving from Newfoundland and Labrador. For travelers on the ferry who are exempt from self-isolation when they arrive in Nova Scotia, such as long-distance truckers, the testing will be mandatory. But we're also encouraging other passengers to get tested as well. And we'll be working in a schedule testing the crew on those ferry ships as well. Testing remains a key part of our defense against COVID-19, and given the variant strains and the case numbers that continue in Newfoundland, doing this testing along with existing measures that we have already had in place for a while at the ferry terminal, and this is an important step to continue to help protect Nova Scotia. And as I said earlier, around testing, that we're emphasizing that even people with very mild symptoms, along with those who are asymptomatic, get tested. I can't repeat it enough. Regular testing is a very important way for us to stay out ahead of the virus or detect any spread in our communities very early on. And so we have testing available at our primary assessment centers. We have pop-up sites that are offering rapid testing in locations around the province. On that, as we talked, as the Premier and I both mentioned earlier, we were increasing testing in 2 communities, in Beaver Bank and in New Minas. We've had cases in those communities that are still under investigation, and expanding our testing and getting a large numbers of people in both communities tested will be an important part of our assessment of trying to determine, is there any undetected to date spread of COVID within those communities. So the public health mobile units are at Beaverbank Kinsack Community Centre today. They were there yesterday and today, working closely with the families and staff of Beaverbank Monarch Drive Elementary School. And this weekend, we'll be conducting community-based testing. And anyone who lives in the Beaverbank area, into Lower Sackville, even over to Fall River, we encourage everybody to go out and take advantage and drop into these testing sites, or you can make an appointment through the online appointment at the Nova Scotia Health Authority website. We will also have a pop-up site at the New Minas Fire Department this weekend. Anyone who in the area, in the New Minas, Kentville, Wolfville area, that we're encouraging to come get tested. Especially, there's an exposure notification, a specific date and time at the Walmart in that community, and especially anybody who was at that Walmart at the specific date and time. That information is on the Nova Scotia Health Authority website. We strongly encourage you to get tested through the pop-up site, or we have primary assessment centers also in Berwick and in Wolfville. So you have 3 different ways you can get tested if you live in these communities, and we encourage people to do that, especially if you are at the Walmart at the specific date and time. Lastly, today is not only Premier McNeil's last COVID briefing, but it also marks our 100th briefing. And I want to take an opportunity first to thank the many people who make these briefings happen. This includes the moderators, the interpreters, the video and photo teams, and those answering questions after each briefing. These briefings for the Premier and I would not be possible without each of you, so thank you. I also want to thank Nova Scotians. You have continued to welcome us into your lives by tuning into these briefings, ready and willing to heed the call to do what is necessary to keep one another safe. And I want to end by personally thanking Premier McNeil for his many years of service to this province as an MLA and as a Premier. These roles are not easy, but you have been willing to step in, take them on, and make hard but necessary decisions, so thank you. It's been a privilege to work beside you for the past year. You have made my job easier, you have treated me with respect and kindness, and most importantly, you have always put the health of Nova Scotians first. So thank you for that, and I wish you all the best on whatever path you travel next. And to all Nova Scotians, have a great and safe weekend and take care of one another.
Dr. Strang, you're going to make me cry, and it's not very good for me to be crying on my last day, but I appreciate your kind words. Thank you very much. Chrissy.
To that note, we'll take one question and one follow-up in the time that we have for today. First question will go to CBC Jean Laroche.
Good afternoon, Dr. Strang. I wondered if you could help me with the logic of what you're doing in terms of the truckers at North Sydney, because it's my understanding, and correct me if I'm wrong, that the federal government has not made it mandatory for truckers who are coming in from the United States into Canada, and there's a heck of a lot more COVID there than there is in Newfoundland. So why have you done what you've done?
So we are working more broadly to build capacity for testing all truckers who come into the province. We're very close. We've had some logistic challenges. I'll be honest, it's taken longer than I had hoped, but we're close to getting testing for truckers at the Irving Big Stop in Enfield. And as soon as we were doing that, and then once we work out some of the logistics, we'll expand that. Once we have good capacity in a number of locations, we will be looking towards making testing for all truckers mandatory. But we need to make sure they have easy access to testing before we do that. But there's urgency because of the situation with a large spread of COVID in Newfoundland. The urgency of making sure that we're testing the truckers coming into Nova Scotia across on the ferry. That is why we've rapidly stood up testing capacity on the ferry and made it mandatory for those truckers. But we are working to make sure all truckers, long-distance truckers, have access to testing, and we will be looking to make that mandatory once we have that capacity and the easy access for truckers established.
Go ahead with your follow-up, Jean.
And this is another question I'm hoping you can, that will help give us some clarity on the why, because I think it was either this past week or last week, got to admit the days kind of blend together, that you had talked about your team looking at the possibility or looking at changing the way who's first in line essentially for the vaccine, because as you would know, a 10-year-old with serious asthma would be much more at risk than somebody who's in great shape at 75 or 80. And I just wondered, what discussions do you continue to have about that, and whether or not there is an appetite to change the criteria based on either illnesses, pre-existing conditions, that sort of thing?
So we've established the main focus is on an age-based process. That is, given we have continuing robust supply and given a good epidemiologic position. If either of those change, then we absolutely have to rethink how we are sequencing vaccine. But right now, what makes the most sense is to, as I talked about last time, once we get into robust vaccine supply, that our main focus will be age-based clinics, starting with the oldest. And that's why we're rolling out 80 plus starting in March, because age is by far the single biggest risk factor for severe disease. Far greater than somebody younger, even if they have chronic health conditions. And also an age-based approach is most efficient and allows us to immunize the most people in the shortest period of time possible. And by taking that focus, the more Nova Scotians we get immunized, they're not just protecting themselves, we're building herd immunity, and they're protecting everybody else around them as well. So, and we're not the only province which is doing this. Manitoba, British Columbia have also announced that their primary focus is on an age-based approach because of it accommodates by far the biggest risk factor and it is the most efficient efficient, fastest way to roll out a vaccine program for the whole population. Within that, we also talked about we're focusing as well on marginalized communities or vulnerable communities. So we're working with our First Nations communities, with our African Nova Scotian communities. We're continue to work with our communities or recent arrivals, other congregate living settings like shelters, our correctional facilities, all very vulnerable people. And then we're also working with the two groups of workers, if you will, that present a substantive risk of introducing or spreading the virus into communities. And those are the people who come across the border, like the long-distance truckers. And then we have very specific work sites who like food processing plants where they cannot adhere to public health measures to do their work. And if the virus does get introduced, we've already had one outbreak in a poultry plant, it can spread very quickly, and that puts the whole community at risk. So by immunizing those two groups of workers, we're actually taking a significant step to protect all of the rest of Nova Scotians. That's our rationale for why we're doing what we're doing. Always based, as I said, if our vaccine supply changes or if our epidemiology changes, we certainly know that we're going to have to go back. And we're already doing the thinking about how we might prioritize differently if necessary.
Next question will go to CTV's Suzette Beliveau.
Good afternoon, Dr. Strang. My first question's for you. I noticed last weekend at the rapid pop-up testing sites throughout the province that about 600 people or slightly more went to get tested. Does that number seem low to you? And I know there are more rapid pop-up testing sites happening this weekend, as you mentioned, Beaverbank and New Minas. How do we encourage more Nova Scotians to go out and get tested?
Well, we continue to use the briefings. My communications colleagues, we're using social media in a lot of creative ways to get the message out there. And we ask all Nova Scotians to set an example yourself and to be part of encouraging and spreading the word within your community. It's, again, another step that we can all do to take care of each other. So, as a Nova Scotian, are you getting tested? Are you telling your neighbors to get tested? Maybe there's somebody in your neighborhood who needs a drive to go get tested. So how are we supporting each other while we in government do all the communication steps to get the message out there as well?
Go ahead with your follow-up, Suzette.
Thank you. My next question is for Premier Stephen McNeil. I know as you mentioned this is the 100th briefing today, is also your last briefing. Nova Scotians have been watching you and Dr. Strang for nearly a year now talk about COVID and, guide the province through this. What's going through your head today, again, on your this being your last day of briefings and a significant number, the 100th briefing?
A lot of gratitude. I'm grateful for the friendships that I have developed. I'll speak more about Dr. Strang later. I'm grateful to Nova Scotians who have followed the public health protocols, and I'm grateful for the kindness that they've shown me over the last 11 months here, whether it has been through an email or when they've seen me on the street or out and about. I'm truly grateful for them and all those who've been walking this journey with us. Dr. Strang talked about his team. I'm very grateful for the team, small but mighty team that has been with me on the 7th floor since March 15th. And of course the people in this room from CNS who they are people, Nova Scotians that work for government, but I consider them friends. We've all kind of come together. So I'm really full of gratitude.
Next question will go to Alicia Draus with Global.
Thank you. I'm just wondering if you guys have any numbers on how many healthcare workers so far have actually declined to be vaccinated.
I don't have any data on that in front of me.
Go ahead with your follow-up, Alicia.
Okay. And just talking about those 80 years old or 80 years and older, if they don't receive a letter from MSI, is it still possible for them to register, or do the letters actually include some kind of specific security code that they have to input?
They should be getting a letter. We'll clarify that in our further communications, but I think one of the things is people have not, the letters aren't going to start going out quite yet, but if people are concerned as they get into the middle of March and they haven't had a letter, certainly, one way they can do that is contacting MSI, because MSI has all the information. They're generating the letters, but I'll take that back and we'll give I'm going to flag it for my communications folks, and we'll give a more comprehensive answer on that next week.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you very much. First off, for Premier McNeil, you've told me that your constituents will be the first to know if you elect to leave your MLA seat or continue on to the next election is called. My understanding is that they haven't heard yet. I'm wondering if you can tell us if you'll stay on.
I'll certainly be communicating to my constituents first. They're not in a hurry to get rid of me, so I'm grateful for the people of Annapolis. I respect them a great deal, and I respect them enough that I will make sure I communicate to them first.
Go ahead with your follow-up, Lindsay.
For Dr. Strang, I'm wondering if you can tell us how these 10 community clinic locations were selected, and approximately how many people are involved in staffing these clinics through March.
So, they were selected based on, we needed to make sure we had good access across the province. Certainly, they're in communities that are larger in size, because clearly those communities are kind of hubs for the geographic area around them, and they, because of their size, that's where you're going to get the greatest amount of the local population, and along with the lens of making sure that we had good access across the whole province. And the way they're spread out is nobody has any difficulty getting or great distance to drive to get to them. I will say we're still working on details, but there's lots of work going on to make sure that if somebody has difficulty, if they're very isolated or they have difficulty themselves with getting to a clinic, there's lots of work going on at a community level to make sure that those people are identified and they're given the supports necessary to get them to vaccine or get vaccine to them. So that people are, we're very cognizant, making sure that everybody gets an opportunity to get vaccinated, even if they may live in a very isolated area or they may be isolated because of their circumstances in their home. So we're cognizant of that. As to the number of workers per clinic, I don't have a specific number on that in front of me.
Next question will go to John Dumont with the Herald.
Thank you. So this is for the Premier and Dr. Strang. As you both pointed out, it's your last time together doing the COVID update. And I'm just wondering if you have any personal reflections on your unique partnership, which some might call a bromance, for the past 11 months.
Well, listen, I've said one of the blessings for me of COVID was getting to meet Dr. Strang and getting to know him. You and I did an interview. I told you good male role models are hard to find, and last March I found one. He's an extraordinary Nova Scotian who I think all of us owe a great debt of gratitude to, and I'm really proud of not only what he's been able to do here, but I'm really proud of the fact that I get to know the man. And I want to say to all Nova Scotians, he may be a great public health doctor, but he's an even better man in person. So that's been my reflection. I'm grateful for it.
Thank you, Premier. And from my side, I think the Premier's on the hot seat for a lot of things, and I've learned a lot in the last year. And I can understand why the Premier's tired after 7 years. But what I've seen is somebody who is principled and honest, and has, and as I said in my remarks, always throughout the last year has put the health of Nova Scotians first and foremost. And I have great respect for the Premier for that.
John, do you have a follow-up?
Yeah. Do you expect will you keep in touch?
Yes, I hope so.
I may have to take a trip. I've never been to Upper Granville.
And I'll have beer in the fridge, sir, when you arrive.
Next question will go to Marie-Eve Broussard with Radio Canada.
Hi. My question would be for Dr. Strang. I'm sorry I missed the beginning of the period of questions, so maybe I'm going to make you repeat some information. But regarding the truckers coming from Newfoundland that are going to be forced to be tested, are they going to be using rapid tests or regular testing?
We're going to be using a combination of rapid tests and because they give a rapid result, an immediate result on the ferry, which is important. But we're also working on how to, we need to, any tests that are positive, confirming that. We're also using that, going to be using other, the other folks with the PCR test as well, and using the lab in Cape Breton. So we're using a combination of rapid tests and the PCR swabs.
Go ahead with your follow-up, Marie-Eve.
And I was also wondering, are there going to be any other people that are exempt to be self-isolating for 14 days that are going to be to be tested?
So we have a number of other categories that that people are exempted from the 14-day quarantine. But specifically coming from Newfoundland to Nova Scotia, the vast majority are going to be the long-distance truckers.
Next question will go to Yvette D'Entremont with the Halifax Examiner.
Yes, thank you very much. My first question is for Dr. Strang. It appears that a number of people who did not receive invitations to the first prototype community vaccination clinic for those 80 years and older had found the registration portal and began signing up their uninvited elders. I'm just wondering what you know about this and what messaging do you have for people when it comes to these by invitation only vaccination clinics?
Yeah, so I mean, we were made aware of this yesterday. A couple of points. I mean, our objective with the prototype clinic was to identify 500 people 80 and plus and get them immunized, and we're going to do that. We're going to learn from that. This is the only clinic where we're going to have this special invitation approach. It's unfortunate that some people kind of gamed the system, found a way to game the system and put themselves ahead of others who had gotten an invitation. So for people that are doing that, I kind of say shame on you. All along throughout COVID, we've asked people to think about others first. Everybody will get a chance to get vaccinated, and the people who got a letter and are now disappointed because they now weren't able to make an appointment in that clinic, I apologize for that. But I hope you're reassured by the fact that you will get a chance to get immunized throughout the month of March.
Yvette, do you have a follow-up?
Yes, I do. So on the subject of vaccination clinics, so also for Dr. Strang, I'm just wondering how things are going with the COVID-19 vaccine clinic volunteer drive, particularly what has the interest been so far from healthcare professionals reaching out to volunteer, and how is that initiative going overall?
It's going extremely well. I don't have specific numbers, but checking in with my team, I'm with them regularly. We're having a significant number of retired physicians, nurses, for example. We have other people that are reaching out, whether they're healthcare professionals or others, looking to be involved in our clinics. And I'm encouraged, and I thank all the Nova Scotians who are doing that. It's yet another way that we're coming together to get through this COVID pandemic by pulling together, by helping each other out.
Next question will go to Victoria Walton with The Coast.
Thank you. This question, I guess, is for Premier McNeil, kind of just reflecting on the last 11 months. I mean, there's no way really to go back in time or change anything, but seeing as Nova Scotia has done relatively well in comparison to some other provinces, would you change the way that you did anything? Would you change any decisions that you made during the pandemic?
I don't know if I would look at it that way. I mean, obviously, when we started this journey, we didn't know about asymptomatic patients. It was a belief they couldn't pass on that virus. I think we all know that's not true. But I think one of the successes for our province is, quite frankly, is that Dr. Strang and I have come out together as both the government and public health. We've listened to people, and quite frankly, we actually admitted what we didn't know. To me, that's a critical thing about this virus. When we started early on, there were so many unknowns for us. That's why we acted very quickly and aggressively in shutting down parts of our economy. And I think those decisions early on, with the acknowledgement of what we didn't know, allowed us to be in a position where good parts of our economy are functioning as long as people continue to follow the public health protocols.
Go ahead with your follow-up, Victoria.
Thanks. And this question, I guess, is for Dr. Strang. We've talked a little bit more today about testing in vaccines in African, Nova Scotian, and First Nations communities. And you kind of mentioned that they'll be deciding in what order people are being vaccinated. So I'm wondering if you can give any more details about, will those communities be prioritizing age differently? Like, we just haven't really gotten a lot of details on how that consultation, how that vaccination is going. So I'm just looking to see if at this point you can give really any more information about the minority communities and how vaccines will work there.
So certainly we're further along in our work with our First Nations communities, and as I'll speak to that, I mean, they've identified that because of their long-standing, kind of socioeconomic and other challenges, that they have, poor underlying health conditions in general. So they've asked that they when we talk about seniors being the most vulnerable, that we reflect that people in those communities that it's at a younger age may have the same a higher level of vulnerability. So they're looking to have start their vaccination at a younger age. Many of them are looking at age 55 and above. They've also brought forward the need that in those communities, language keepers, people who keep the culture and their language alive, are critically important, and that we need to make sure that they're a priority for getting vaccinated. So both on accommodating the age as well as the cultural and language keepers is a significant way that we've, to those communities say, you're in charge, you're in many ways in control of much of this. So who you prioritize in your community, we're giving them that space to do that, because and I think that's entirely appropriate.
Next question will go to Mike Gorman with CBC.
Thanks, Dr. Strang. I'm wondering if you could give an update on the effort to get needles in arms in long-term care homes. Is that on scheduled? Was it set back at all because of the delivery delays, or what can you tell us about the progress with that?
So it was slowed down a little bit because the reduction in the amount of Moderna vaccine, but we're still moving forward. We keep moving vaccine into additional long-term care facilities, and going back to the ones for second dose. We'll be giving a more extensive update on that with numbers next week, as we usually do that on our the first briefing of the week. We're still waiting to see what the exact numbers are in terms of our Moderna supply for March and what impact that may have.
Go ahead with your follow-up, Mike.
Dr. Strang, perhaps it's too early for you to know the answer to this, but with the news today that the Pfizer BioNTech vaccine perhaps doesn't need to be stored in such cold settings as initially thought, how, if at all, will that change vaccine rollout and delivery in this province?
It'll just make if that turns out to be true. Now, that is from in the evidence being brought forward by Pfizer in the U.S. They'd have to do the same thing and get it approved under those different conditions by Health Canada, and we're not there yet. But if it does turn out to be true, it just makes our vaccine clinics and our process a little easier. But we have built our distribution system so with ultra-low freezers, regular freezers, and fridge stable and refrigerators. So regardless of the temperature requirements of the vaccine, we've already built a program that will accommodate all three of those. If we were able to use just regular freezers rather than ultra-low freezers for Pfizer, and that generally extends and it makes it easier to the distribution out to clinics, it just makes things a little bit more efficient. But as I said, we've already built capacity regardless of the three different types of temperature requirements for any vaccine.
Next question will go to John McPhee with the Herald.
Thank you. This is for Dr. Strang. I'm just wondering for the vaccination clinics next month, the community clinics for the 80 and above category, will there be any prioritization within that category? I'm just wondering, are you going to start with the oldest, like 95 and down, or those who have more more complications with their health, that kind of thing, or is it just going to be kind of a straightforward statistical, go by the birth date sort of thing?
It's your birth date and make an appointment. It's 43,000 people. So to start to kind of then tease that out about a further, finer age groups or health conditions, that actually makes it much more difficult to administer and would make it a slower process. So we're starting with 80 and above, and then once we get through them, then we're going to go in 5-year increments. It'll be 75 to 79, then 70 to 74, based on age. As I said earlier, it's the biggest risk factor, and it allows us to be as efficient and fast as possible as we move through our clinics.
Go ahead with your follow-up, John.
Thank you. This is again for Dr. Strang. Regarding the stability of vaccine shipments, we've kind of had a mixed bag in terms of the reallocations to the northern regions and delays in production. Are you comfortable that we'll have a steady and predictable supply from here on in?
We're certainly having very, strong signals, strong reassurances from the federal government that the Pfizer vaccine now seems to have stabilized. We're getting, it's guaranteed now or confirmed that we'll get 10,000 doses a week until the end of March. We don't have confirmation on the April amounts for Pfizer. That's simply, the federal, we don't go that far out, but we're fully expecting that the vaccine will ramp up well beyond that as we get into April. The Moderna is a short-term issue about reallocation to support the unique needs of our northern territories, and then we'll be back on track with our Moderna as well. And we're certainly expecting the AstraZeneca now approval has been delayed through Health Canada, but we are expecting other vaccines to come online as well.
And that's all the questions we have for today.
Thank you, Chrissy. Since this is my last briefing, I'd like to end with some thank yous. First of all, Dr. Strang, I'd like to express my deep appreciation to you from all Nova Scotians for the work that you have been doing on behalf of us, but particularly since COVID, March 15th, as a matter of fact. And I appreciate and thank you for the kind words you said about me, and I appreciate the kindness that you've shown me. And I know that when I end my day, you go home to continue to add more work at home. And I just want to tell you that you're a remarkable man, and I'm grateful that our paths have passed, our paths crossed. And I look forward to continuing to support you. And I want to tell you and all Nova Scotians, even though I may not be sitting in this chair, I will do everything I can to support Dr. Strang and the new Premier as they move forward to continue to make sure they roll out the vaccination across our province. To my caucus colleagues, I want to say thank you for your unwavering support always, but in particularly in the last 11 months. There was many unknowns when we started this in March, and you've continued to support me. I get the appropriate calls at the right time of encouragement and thanks, and I want to say thank you to all of you. I particularly today want to acknowledge Minister Fury, who earlier today announced that he would not be seeking re-election whenever the election is called, and that he will be stepping out of cabinet as of next Tuesday and will sit as a private member. Mark, we've had a tremendous run. You're a man of tremendous integrity. I've always said I was blessed to be given the opportunity to be the Premier of this province, but I was really blessed to be surrounded by great Nova Scotians, and you're one of them, and your integrity never wavered in the entire time that I've known you, from 2009 until now. I look forward to playing some golf with you this summer and continuing to build on our friendship. And I will always, always be grateful that you answered the call for me in 2009 and that we had the chance to serve. And I remember very vividly swearing you in as Minister of Justice and the Attorney General of our province. And it was one of the proudest moments of my time here. So I wish you well, my friend. I want to say to those who are running again, I wish you all the best. I will be here to support you the best I can, and I'll be here to support Premier-elect Rankin as we continue down this journey of ensuring that the vaccines get in the arms of Nova Scotians. I do want to acknowledge my staff. Many of you won't know this because you would only see me out here. On March 15th of last year, a small number of us became the first bubble in Nova Scotia. On the 7th floor of this particular building, we came to work every day and stayed away from our own families because there were many things we didn't know about this virus but this group of hardworking Nova Scotians were committed to this journey and to me. And I particularly want to acknowledge my Chief of Staff, Laurie Graham, who, Dr. Strang, I think you would admit, this has been a trifecta. The three of us actually have been moving this forward. I think she's had more meetings with you than I have. But not only has she been a true champion and professional on this file, but she has helped support and lead a group of dedicated Nova Scotians who were committed to ensuring that we were the safest place possible. And your guys' effort under your leadership, Laurie, has definitely saved lives in this province, and we are grateful for your sacrifice on behalf of all of us. And I want to speak directly to Nova Scotians. I can't tell you what it has meant to me over the last 11 months for your generosity of spirit and your kindness towards me and your thoughtfulness of supporting me and asking me how I'm doing. At the same time, you wrapped your arms around each other. You know, we take for granted sometimes this beautiful province we live in. We have beautiful scenery. We have magnificent views. We don't often look back and say, you know, the people are pretty good too. And you demonstrated that in spades, really, over the last 11 months. And I am deeply grateful. My family and I are deeply grateful for the kindness that you have shown, both myself, Andrea, Colleen, and Jeffrey. You knew how difficult this was, and particularly in the months of April, when the tragedy hit our province on top of what was going on with COVID. Your thoughtfulness and kindness and caring actually sustained us. So I want to ask you to continue to provide that support to Premier-elect Rankin when he comes forward to be here with Dr. Strang, as they now will continue and start the next 100 days of ensuring that we get the vaccine note in your arms. You will never know how important it is for your encouragement to put gas back in the tank, to give someone energy to move on to the next day. So I just ask you to show Premier-elect Rankin the same kindness you've shown me, and continue to support each other. We can do this. We are doing it. The world is watching us in a good way. You've done an outstanding job, and I know we're getting close to the finish line, but now's not the time to waver, not the time to forget public health protocols. Now's the time to embrace them and continue to support one another. And I look forward to seeing you at different parts of our province, on the street, in a restaurant, or quite frankly, at home in Upper Granville. Thank you very, very much for giving me the pleasure to be your Premier and supporting me through this journey.